Hi, welcome back. I'm Nadine Groskoyak, also known as Gluten Free RN. Always, we are going to investigate, explore, and discuss all things related to gluten-free living, paleo lifestyle, non-celiac gluten sensitivity, celiac disease, and all other associated autoimmune diseases and conditions related to eating gluten. And how much better people, and today we're going to find out how much better our pets can be when they're on a gluten-free diet. So welcome back, settle in, and today we're going to talk about in episode 2 of season 1 on the Gluten Free RN podcast, how your pets can benefit from a gluten-free diet also. Now, several years back, I wrote a blog post on how much better our dog got once we put the black Labrador on a gluten-free diet. She was a bit of an old Labrador. Her name was Slugs, and she would have the worst gas ever. But when I went on a gluten-free diet, because I'd been diagnosed with celiac disease, and we had to clean out our entire kitchen of gluten and any cross-contaminated food products, we found out that I also should get rid of the dog food too that contained any grains, mostly wheat, barley, oats, out of our house because that was a potential cross-contamination risk. So we went out in the garage, took all the old bags out, took them down to the animal shelter, and restocked our garage with dog food that was actually, at the time, the best dog food we could get, which I believe it was wild something. So it was a long time ago. And so our dog actually got better on a grain-free diet. And that was very well noted by the entire family because prior to being on a grain-free diet, our dog, the black lab, also known as Slugs, would clear the house with her gaseous emissions, also known as lab farts. They were horribly stinky. So I was very interested by the fact that not only were my GI issues or gastrointestinal issues, along with all of the other skin issues and neurological issues I'd been suffering from, all of those things were getting better for me, but also for the dog. So the more I thought about it as a nurse and the more I started to investigate it, the more I realized that our dogs and cats should not be eating grains either. So in fact, I actually gave a talk entitled Gluten Intolerance in Our Pets quite a while ago for the community, and I gave that along with a physical therapist that works with dogs and cats in physical therapy mode, but she won't actually work with those dogs or cats unless they're on a gluten-free diet. She won't work with people either unless they're on a gluten-free diet because she can't actually fix them until they go gluten-free. So our hips are actually affected by the gluten quite horribly. So if you have any back pain or hip pain, especially if it's on the right side, that's potentially related to a gluten issue. There's a reason for that. We won't go into that right now, but if your right hip is internally rotated and your right leg is shortened, it very well could be because you are gluten intolerant and or celiac. Interesting, huh? So our pets are affected the same way, mostly because of how our intestines are laid out in our abdomen. So while Slugs was getting better, even as she was getting older, she was feeling better, more spry, not as much gastric upset for her, and I was getting better. So we opted to give this class down at the library, and I gave it along with Patrice, the physical therapist, and a vet in town. And I believe there was one other person. Please keep in mind this was several years ago. Interestingly enough, the place was packed. The entire library meeting space that we had booked for this event was packed with community members and dog and cat lovers. All kinds of people were there, other vets, because these people love their pets so much. Interestingly enough, and I've noted this over the years, is that when we try to give a lecture for children, not so many people show up. Not as many parents show up. Just an interesting note on the social dynamics that we actually sometimes love our pets more than maybe our children. I don't know how to make that less of a thing, but there you go. Sometimes I think that, and our pets have always been important to our family. We've had multiple dogs at a time. We've never had cats, but our dogs are very much a part of our family and always have been. So we gave this class and it was quite intriguing. So I had to do my research, of course. And my topic was the gluten intolerance in our pets. And so I'm going to go through some of the information that I gave out during that lecture because I thought it was quite interesting. So really, how different are we? Throughout time, dogs and cats have never really been grain eaters. How many times have you ever seen a dog or a cat leap over a fence to get into a field of wheat or barley or any grain for that matter to go in and chew on it? It just doesn't happen. They don't naturally or instinctively look for grains for their diet. That would never be a part of what they would have eaten over the millennium that dogs have been present in our lives. And the same for cats. They're pretty much mousers and look for birds. So definitely more in the omnivore scale of animals. So they would look for things to eat that they, had bones and they could chew on, that had some meat. But never grains. Grains would not be something that they would look for. Dogs sometimes would be noted to eat grasses, green grasses, mostly for the chlorophyll, so that their bellies would settle down if they were upset at all. So interestingly enough, we all noted also that the dogs over time, over the last several decades, have been found to be developing similar diseases and disease processes to what our humans have been developing also. So rheumatoid arthritis, colitis, all kinds of GI issues, autoimmune issues, hip dysplasias, which is not, some dogs are prone to that, but on a much grander and greater scale. So we're really not all that different from our dogs per se. Even sometimes we tend to look like each other over time. I know that there's a couple dogs that we've had over the years where there's an uncanny resemblance to their masters and sometimes to us. And I don't know if we picked them or they picked us, but either way, they come to live with us. And sometimes we look like each other. So definitely gastrointestinally and nutritionally, certainly dogs and cats need different nutrition than we need in different amounts, depending on how big or small the dog or cat is. But overall, we're all omnivores, which means we eat meat and we also eat vegetables or plant matter. There was a 1992 NIH study entitled Dietary Modulation of Gluten Sensitivity in a Naturally Occurring Enteropathy of Irish Setter Dogs. Irish Setter dogs are actually predicted to go extinct. And so perhaps this is an interesting study that showed that Irish Setter dogs are predisposed and potentially going extinct because they develop a similar issue with the gluten. Affected setters reared in a normally wheat-containing diet exhibited partial villus atrophy, intraepithelial lymphocyte infiltration, reduced brush border alkaline phosphatase activity, and it goes on, basically saying that these Irish Setter dogs were developing villus atrophy and celiac disease based on the fact that they were eating a wheat-heavy diet. Or in this article, it says a normal wheat-containing diet. So once they put them on essentially a paleo diet or a grain-free diet, then these dogs got better. Interesting, huh? So there are studies out there, but there's not enough. And actually, when I was doing the research for this particular article in this presentation, I called up a couple of people, mostly geneticists, and I'd say, hey, is there any way to test dogs for the HLA DQ2 and DQ8 genes to find out if they're actually gene carriers for those particular genes? Interestingly enough, HLA stands for human leukocyte antigen. And so there is no, to my knowledge, this might be different now because this was 8 or 9 years ago, canine leukocyte antigens. So you would have to change, I guess, I understand that you would have to test the dogs differently or for a different genetic component. So I had mentioned that we sometimes look like our dogs, and we did have a dog named Pumpkin, and Pumpkin was a long-haired dachshund and very much sort of looked like me. Our hair color was very similar. So I guess that is a definite possibility that you can, in fact, look like your dogs over time. But over time, we've also had black labs, yellow labs, white labs, pound puppies, all kinds of things. And we've loved every dog we've ever had, except for, I think, one, which was a wee bit obstinate. There's more than one that was obstinate. Let me say that we had the most incorrigible corgi at one point, and she had to go find a different home. Even the lady that was the dog trainer, she said, "You know what? I've had corgis my entire life, and this one is untrainable." So she actually did have to go live with someone else I had a baby and another dog. Chaos has ruled our life for the most part. And so at that point, 2 dogs and a brand new baby, my daughter Hannah, was a little bit too much for us to take on. So just a nice little reminder that we are what we eat. Our dogs and our cats are what we eat also. So hopefully your dog is eating a food that is appropriate for his breed and also for the fact that he is a dog and he eats meat products and plant matter. And cats, for the most part, are mousers, or for the unfortunate bird that gets in its way and then brings you the bird or the mouse onto the doorstep or into the house as a gift. That's what they eat. So we want to keep, for their body structure, for their biology, the food conducive to what is going to make them the most healthy. So what are some signs or symptoms if your dog is affected by gluten in their diet? So if you feed your dog what you think is probably the best dog food or pretty expensive dog food, but if it has grains in it, it might be causing some symptoms in your dog. And you should definitely talk to the vet about this. If your dog has any dermatitis, such as chronic dry or flaky skin, hair loss, redness, bumps, rashes, or constant scratching, doesn't have fleas, but definitely is suffering from skin ailments, you may want to consider that whatever's going on in the outside is also going on in the inside. So those rashes tend not to be a topical expression of something going on. It's more of an internal expression. That is, it's an external expression of an internal issue. So typically is caused by the food that they're eating or some intestinal upset caused by something that they might be exposed to either in their diet or that they're getting a hold of out in the environment. Chronic ear infections, yeast overgrowth, dark smelly waxy debris in the ears, head shaking and scratching. So if the intestines are healthy, the immune system will be healthy also, and same with us. But in the dogs, it is expressed in infections, just like in human beings, that our body normally would be able to take care of. But if there's inflammation or damage to the immune system in the intestines, then the immune system can't work appropriately, and dogs and cats will be susceptible to any type of infection. So chronic GI upset, such as diarrhea or constipation, mucousy stools, vomiting, I probably want to avoid all those things if we could, because they can be messy, especially if you're gone to work all day and your dog or cat's home and you come home to a big stinky mess. Repetitive chewing at the feet. So again, a lot of those grains can be irritating and cause inflammation to a lot of the tissues in the dogs and the cats. So those are just some of the signs and symptoms. Achy joints, you know how the dogs get up and they're like not really walking straight or having a hard time getting their legs underneath them. Those dogs need to be looked at for potential gluten intolerance. So increased susceptibility to infections, allergic and inflammatory reactions, pancreatitis and hepatitis, which is your pancreas getting inflamed, and hepatitis is your liver getting inflamed, or in this case, your cat's or your dog's liver and pancreas, autoimmune diseases, Cushing's, Addison's, arthritis, again, that's joint pain, and inflammation in the joint, seizure disorders, abnormal behavior. We've certainly had dogs that actually had quite a bit of abnormal behavior and somewhat obstinate behavior and thyroid problems. So dogs and cats should really not have to be on medication very much, if at all. Our dogs, when we were growing up, were pretty healthy, even though they kind of ran wild and, within the house and everything. They weren't very fussy. We didn't have to be very fussy with them. But what I'm finding is that a lot of people over time have had to be much more fussy with their pets as far as making sure they get their medication on time and they're on multiple medications, or they always have to go in for a procedure. This should not be the case with our dogs and our cats. Really, they should be pretty healthy. So testing for gluten intolerance can be tricky. To my knowledge, there isn't very many tests available, and we can actually investigate that a little bit. I'll call a couple vets I know and find out if, in fact, they do test for celiac disease or gluten intolerance with pets at this point, or if they go straight to a clinical trial when the pets show any sign of a problem with dermatitis, which is the skin issue and inflammation of the skin, or GI upset, which would be the nausea, vomiting, or diarrhea, behavior issues. So a clinical trial of a grain-free diet or a paleo diet for a dog or cat is completely reasonable. Whether you are talking to your vet or just making a decision, I don't recommend that you make a major change in your pet's diet all at once, maybe over a week or two. Change the diet so that your cat or dog's microbiome can actually try to catch up, and that it's not such a shock to their system, shall we say. It can be a shock to our system also to rapidly change a diet and expect that we're going to get better immediately without getting worse first. So a clinical trial is when you actually take out the grains from the diet, replace the food that your dog or cat eats with appropriate food that does not contain any grains. So a paleo diet is meat and fish, nuts and seeds, fruits and vegetables. So you can look at that and go, what would be appropriate for my dog or cat? So you're probably not going to go out and catch mice and birds and whatnot for your cat. And it'd be kind of hard to feed your dog, food that you caught or whatever, which, by the way, is how people used to feed dogs that they kept in camps or as pets. So there are several options. There's grass-fed, no antibiotic, no hormone beef and beef bones that you can use for your dogs to chew on, and then also the beef itself, chicken, turkey, and bison. So you can get the end parts or the waste that might be from a butcher that you can go, I don't want any prime cuts to feed my dog, but I would like the scraps that, sometimes you would put into a burger or something that I can actually take home and keep in the freezer and feed my dog some nice fresh beef, bison, deer, elk, whatever you have access to. But, you don't have to use prime cut steaks or roasts or anything like that. But you can use it raw. You can cook it lightly. Animals really don't cook their food. So raw is perfectly appropriate for dogs and cats. So you don't have to cook it. It can be raw. But at the same time, I would highly recommend that the beef that you're getting or the meat that you're getting is grass-fed, no antibiotic and no hormone, and of pretty high quality. Again, we love our animals and we want them to be healthy. So just a couple stories to really let you know how much the cross-contamination is a risk for not only for me living in a house with animals and having to feed them and whatnot, but there's a couple stories of children that were just not getting better on a gluten-free diet. And come to find out, they were small children. They were still climbing around on the floor and their dogs were looking them in the face. And it was really what the dogs were eating and then licking their face, causing the cross-contamination. So these kids, once the diets for the pets changed, these kids actually improved in health, and their numbers went down perceptibly on their celiac panels and whatnot, and their bodies were able to recover. But the cross-contamination is such a huge issue for celiac patients because of just a breadcrumb will trigger the same autoimmune response. So anytime we're looking for cross-contamination risk, we're looking for that breadcrumb that is a potentially triggering the same autoimmune response that, let's just say, a whole piece of cake would, or a piece of pizza. It really takes just a minuscule amount of gluten consumed or on our skin or anywhere that would cause a problem. Now, there was another case of a couple farmers in Ireland, and it was well written up in a research article. They were determined to have refractory celiac disease, which means they were having signs and symptoms of celiac disease that was not healing even on a gluten-free diet. And frequently this refractory celiac disease results in lymphoma or bowel cancer. And there's really not very much you can do for it. There's steroids and there's treatment and a couple other things. But what the researchers did was they went out and because these gentlemen were farmers, they went out to their houses and they looked at what they were eating, and they followed them around for a couple days. And what they found was that their houses were perfectly gluten-free. What they were eating was perfectly gluten-free. But when they followed the farmers out to the barns, they found that they were feeding the animals grains. And that exposure just from in the air, airborne gluten, and I'm sure they were touching it, and who knows how else they were getting contaminated. They were still getting contaminated with a pretty good dose of gluten, either airborne or through their skin, or who knows how else. So once they cleaned the grains out of the barn and replaced the animal feed with gluten-free animal feed, these farmers were perfectly fine. They did not have refractory celiac disease. They just had continued exposure to gluten, which of course we try to avoid at all costs because it causes continued damage if we don't get it all out. So, should you feed your dogs people food? Well, if that people food is junk food, just like some people do eat, like pizza and drive-through food and fast food, which I don't think is food at all, if you eat that, please don't feed it to your dogs. Have a little bit more respect for your animals than you do for yourself, I guess, at that point. Really, they should be eating appropriate food for their biology, which means they should be eating meat and fish and, let's see, some vegetables would be a good idea. Very rarely fruit, of course, but vegetables are a good idea. And that doesn't have to be anything fancy. It can be squash. Dogs actually love squash in the form of pumpkin or acorn squash, but not so much in the fruits. And there's lots of things that dogs and cats should never have, such as hazelnuts or chocolate or grapes. Those things have been determined not to be very good for dogs at all, and they'll sometimes make them sick or kill them. So, of course, we want to make sure that our dogs and cats are fed what is appropriate for them biologically and what will help them be healthy over time and to live a long and very happy life with us, of course, as long as possible. Do you know what's in your dog food? Have you actually looked? Maybe now's a good time to go out wherever you keep your dog food, look at the bag, look at the cans, check and see what's in there. Really, there's very little standardization in the dog food or the cat food industry as far as disclosing what's in there. But there's a lot of reputable animal food producers that will tell you exactly what's in there and whether it's organic and how clean it is, whether it's processed with other things in the same facility. Of course, when you get things from a butcher, that's a whole different story. But you really do need to know what you are feeding your cats and dogs. Because if they're sick, please, number one, first, look at what they're eating. And I remember as a child always going into the veterinarian with our whole menagerie of dogs and pets and whatever we had. And the first question they would always ask is, what are you feeding the dog? Because it has such a huge impact on their health. It was always the first thing. Rashes, seizures, didn't matter what the issue was, the health issue of the pet. It just mattered what they were eating. That was the first question. I think we've gotten away from that. So just make sure the standardization with the dog food that you're getting is a high quality. One of the places I like to get my dog food is from Animal Crackers, which is in Corvallis, Oregon. And they have a huge selection of grain-free, really high-quality pet food. And they're very knowledgeable about answering any questions about finding what is the best dog food or the cat food for your pet. So go in, find your local pet food store, go in, quiz them, find what's best for your pet. A lot of these pet stores allow your pets to come in, they'll look them over, they'll make recommendations, and frequently they'll have sample-sized cans or bags of dog food that you can try to see which one is the best for your pet. There is a nice little test that's called Easy Gluten. You can find the test kits at www.easygluten.com. They're from Florida, and it's a ELISA technology test for gluten. It's easy to use. It's a little dipstick. I call it a pregnancy test for gluten. So you can use it to test for the presence of gluten in your food. It works for dog food too if you're concerned that the food that you're feeding your dog isn't in fact gluten-free, because we really do want it to be gluten-free or gluten zero, as my friend Dr. Ford would say, even for the dogs and the cats. In this particular test, this little pregnancy test for gluten in your food is sensitive enough to detect levels of gluten as low as 10 parts per million. So 10 ppm. And really what we want to do is make sure that there's zero gluten, if at all possible, but less than 10 parts per million is certainly an attainable goal. If it's much higher than that, then your risk of contamination or cross-contamination is still going to be pretty high. And a lot of these dogs or cats don't get better. We see it in people too. Interestingly enough, we did try, Taste of the Wild. That's the one that we had originally put on our dogs on. And it was great. There were several, again, this was several years ago, there were several that were negative for gluten with the Easy Gluten test strips. I went through and I tested about 15. So Honest Kitchen, Nature's Valley, Instinct were negative for gluten, and there were several that were low positive. And then there was a couple that were actually high positive. I'm not going to give you the names of any of these only because this information is relatively old and I would have to redo this particular testing to find out which ones are actually still negative for gluten or highly positive for gluten. LTD Natural Balance is another one that was a low positive at that time. Origin, Taste of the Wild, again, was the one we used primarily for a period of time, quite successfully. So you yourself can, if you have any questions or you want to just be a scientist for a little bit and do a little bit of a science experiment, you can get those test kits. They're kind of expensive, but if you're spending a fair amount of money on your dog food, you really want to make sure it is healthy and gluten-free. This doesn't have to be hard. You just have to be somewhat knowledgeable to make sure that your animals are, again, as healthy and as happy as possible, because you want them to live a long, healthy life with you. So that pretty much wraps up this episode on the diets for dogs and cats. And I did find out most recently that there's a new puppy addition to our family circle, and her name is Palmer. And she is a beautiful, beautiful white fluffy ball of fur. And she hangs out with Harlow, my grandpuppy, who's also on a paleo diet. So both these dogs are on a paleo diet. They're beautiful, very healthy coats. They're happy. They interact appropriately. They're not mean. They're very loving and listen, easy to train, beautiful dogs. So if you want to have a beautiful, easy to train, lovely dog that is your companion for a number of years, please consider what you feed them, how you feed them, and feed them the highest quality that you possibly can. Getting the cheapest bag of dog food from a big box store is perhaps not the best thing to do for your pets for their long-term health. So thank you very much for tuning in. This is another episode number 2 of Gluten Free RN. Thank you very much for listening, and I will see you. Actually, I won't see you. You'll get to hear me at the 3rd episode every Friday at 5 p.m. You can also find me at www.glutenfree.com, on Instagram as Gluten Free RN, on Facebook as Gluten Free RN. And if you like this podcast, please feel free to leave a review on iTunes. It very much helps us have an idea of how well we're doing, how well I'm doing with the podcast. And if you have any ideas for future podcast topics, please let me know. If you have any questions that really need to be answered, you can always email me at nadine@glutenfreern.com. Until next time, enjoy your life, start getting inquisitive, and find out what you're feeding your pets. Thank you very much, and until next time, enjoy.